So a cataract is that cloudy central object that you just saw there. And when we take it out, we actually use the same location in the eye to put an artificial lens implant. And this is what the laser looks like. There's a bed, and there's a portion of the laser where that laser beam comes from. And it's a cold laser. It doesn't hurt. It's very comfortable for the patient. Here's what that imaging looks like. So we get to see very precisely all the structures of the eye. You can see the pupil and the iris. And it'll take that foggy yellow vision and make it nice and crystal clear. And traditionally, those incisions that allow us access to the eye are made with a blade like that. But with the laser, there's a very precise way to make those incisions instead. Here's that blade again that's using just a metal blade to create the incisions that decrease the astigmatism in the cornea. That's the curvature of the cornea. And here you can see it being done very, very precisely, a very uniform shape to that incision, exactly the length and depth we want it to be for a patient's eye. The next step is that we go in with a sharp instrument to start peeling that outer membrane, the capsule, from in front of the cataract so we have access to the cataract. And that can be done with a forceps and manually. And it's pretty uniform, it's pretty circular, but with the laser, it's absolutely a circle perfectly every single time, exactly the size and shape and location that we need it to be. And when we go in, we just kind of pick up that little piece and it comes out as one single unit, uniformly the same every single time, with the level of precision of a computer, really. The next step is to soften up the lens, break it up into larger chunks that can then be divided and removed, and that's done manually and with the ultrasound technology, putting energy into the eye. If we do it with the laser, it's very, very precise, very quick, and the amount of energy needed to perform that softening is much, much less. Once the nucleus, the cataract itself, is softened with the laser, removing those additional pieces of the cataract happens more easily and with less energy. So the amount of time in the eye can be reduced, and the amount of energy that the cells within the eye have to deal with is also diminished. So you can see on the right, already done taking out the pieces of the cataract, and on the left, it happens as well, same technology, but a little bit longer time, a little bit more energy needed. Once the cataract is removed, we can put that artificial lens implant in its place. It sits right where it should, and if we have a very precise opening there, we know exactly where it's going to end up, and that gives us some increased precision in determining what the outcome, what the vision will be.